Welcome back to Drug Talk, everybody. In today's video, I want to quickly go over 3 things that you should be aware of before using Valium or Diazepam. Number 1, there are black box warnings associated with Valium. These warnings are really for all benzodiazepines, which is the class of medication that Valium falls into. The use of benzodiazepines, including Valium, exposes patients to the risk of misuse, abuse, and addiction, which could lead to overdose or death. It should be noted that the abuse and misuse of benzodiazepines is typically seen with other substances such as medications, alcohol, or other illicit substances. Therefore, before prescribing Valium to a patient and throughout the whole treatment of therapy, we must assess the patient's risk of misuse, abuse, and addiction. Another warning associated with benzodiazepines is that when benzodiazepines are used together with opioids, they may result in profound sedation, respiratory depression, coma, or death. So we always want to be sure to reserve the prescribing of benzodiazepines and opioids together just for patients whose other treatments were inadequate. It's always preferred to limit the dosage and duration of therapy to the minimum time required. And the healthcare team would want to follow up with patients throughout treatment to monitor for signs and symptoms of respiratory depression. Number 2. After starting Valium, you may experience drowsiness or somnolence. Somnolence is a state of drowsiness or a strong desire to fall asleep. Because of this side effect, it's a good idea not to do things like drive a car or operate heavy machinery just after taking one of your first doses of Valium. You should wait to do these things until you've been using Valium long enough that you know how the medication makes you feel after you take a dose. This drowsiness is thought to be caused by an increase in the inhibitory neurotransmitter known as GABA. And number 3, although it's not overly common, some patients who use Valium have experienced suicidal thoughts. After starting therapy with Valium, physicians and healthcare teams may want to monitor patients for changes in mood. The main monitoring parameter here is to watch out for a decrease in mood or signs of depression or worsening of depression. Patients should be vigilant to monitor themselves for suicidal thinking and behaviors and let their physician know if they experience any of these thoughts. It's also important to note that this is a possibility with other benzodiazepines as well, not just Valium. And that's all we're going to discuss today with Valium, but before you take off, I wanted to quickly let you know that you can pick up a copy of my new book, The 5th Episode, Inside the Manic Mind, by clicking on a link in the description of this video. Take care.